Hi, thanks for joining us. This is Josh Kling. I'm the CEO of Newport Medical Solutions, Newport Med for short. And in this session, we're going to be going through the 2022 CPT code changes. We've also included any pertinent ICD-10 codes, and we will be looking at the ones, we've narrowed down all the changes to only the ones that directly affect our pulmonary medicine clients. So I'm also joined by Nilima and Brooke, who are experts in the coding field and lead our coding teams. And so I'm primarily going to be quiet and let them run through this. The first slide might look scary, like 405 editorial changes. Don't let that scare you. We've narrowed it down to your specialty, pulmonary medicine. And there's not many, and it looks like the ones that there are either clarifications or new codes that further clarify previous codings that may have been more generic. So Nilima, I'm going to quiet down and let you jump in.
Sure. So we have two new codes added for pulmonary diagnostic testing. 94625, which is for outpatient pulmonary rehabilitation without needing to have continuous oximetry monitoring, and 94626 when there is continuous oximetry monitoring. They should not be reported when pulse oximetry services are being reported.
Okay, and with, yeah.
I know you've done a lot of due diligence on looking at previous definitions and the new wording.
Yeah, absolutely. So for critical care services with concurrent care, if you have two practitioners who are providing this care to the patient on the same day, the individual physician or MPP providing the follow-up or subsequent care can report their time with the add-on code 99292. Now, you can also add time together for that initial critical care service to reach that allotted 30 to 74 minutes. However, in order for the subsequent provider to be able to bill 99292, you will have to meet the complete 30 minutes. So a total time of 104 minutes will need to be met if you're adding initial critical care time up together between different practitioners. And for split shared services, this is when we are seeing patients together and jointly providing critical care services. With this, whomever is providing the majority of the care or making that medical decision making process, they will be the ones who are going to be billed under. But it's very important that documentation is clear of what time is being spent and who is making that MDM. Especially with CMS, they're very keen on wanting to pay a reduced rate if they can. So just make sure that your documentation is clear, and so we are able to build that correctly. Nilima, do you want to take over digital medicine?
So yeah, there's remote therapeutic monitoring service codes that have been added to specifically be able to report therapeutic monitoring that's done remotely. So there's 98975 through 98977 for the initial setup, education, and then the follow-up. And there's 98980 and 98981 for the interactive communication part of, so it's basically management of the monitoring. These codes are actually for our respiratory physicians and our musculoskeletal doctors. They can now switch from using 99453, which was a more general remote monitoring code series, to 98975 and 98980. And then we have, lastly, these codes that have been listed on the slide, which are now included in telemedicine services. These codes are not new. They're existing codes that have been added to the list of telemedicine services. They're all represented with a star in our CPT manuals to tell us that they will now be recognized for telemedicine services with the necessary telemedicine modifier, which is 95.
I see 99211 there, which is an E&M service. Brooke, does that mean the other E&M services are not Telemedicine Services any longer?
It does not. They still are recognized as telemedicine services. This is just a list of newly included telemedicine services that have been added to the CPT manual.
Okay, thank you for the clarification. So that is the end of our presentation. As you can see, it was pretty quick, but we are here for you. If there's any further questions that you might have, or if you want further clarification on anything on this presentation, please email us at coding@newportmed.com. We will get back to you as soon as possible. If there is a delay in our response, please do not think that we are just letting it sit in our inbox. We're likely doing our due diligence to make sure that any answers we give you are accurate and have the relevant due diligence performed before we respond. So thanks, Neelima and Brooke, greatly appreciate it. And thank you all. We hope to hear from you or speak with you soon.
Thank you.
Thank you.